if I'm using repeated movement testing of the spine to determine if a patient's disorder is a mechanical joint derangement in the spine, there are many pieces of information I'm gathering in the verbal history and the physical exam that make me decide which repeated movement test to use and or which repeated movement I think will be fruitful. One of those pieces of the puzzle is the symmetry or asymmetry of lateral movements. Lateral movements in the neck include rotation left and right and side bending left and right. Rotation in the thoracic spine is the lateral movement, and the lateral movement in the lumbar spine is side gliding left and right. Symmetry is in regards to the quantity and the quality. So if left rotation of the neck and right rotation of the neck are symmetrical in terms of quantity, and qualitatively the person feels about the same doing both, it's not like when I rotate to the right, it shoots pain down my right arm, but when I rotate to the left, I feel fine. That would be asymmetrical. If there's symmetry in quantity and quality in the neck of both the spine flexion to the side and the rotation, I'm starting to think that it's more likely the movement that we have to investigate and the movement that will be fruitful is somewhere in the sagittal plane, which is in this kind of forward and back plane of flexion and extension. And that same reasoning applies in the thoracic and the lumbar spine. If the side gliding is symmetrical in terms of distance or quantity and how it feels, I'm thinking we're probably going to stay sagittal. That doesn't mean this person may not need a lateral movement of the spine or a combination of a movement that's both sagittal and lateral, but the odds are lower. So in that verbal history and the physical exam, I'm listening for lots of different things. Symmetry of movement is going to be perceived in the physical exam observationally and sometimes passively when I feel, for example, how much rotation is in the thoracic spine or how much side gliding is in the lumbar spine. But of course, I'm relying on the patient to tell me what it feels like. So of course, during the movements, when we test the one-off movements in the physical exam, I'm definitely asking the patient what he or she feels. There are other pieces of information like the asymmetry or the symmetry of symptoms and provocative movements that make the person feel better. Lots of different intel that I'm gathering, but symmetry of lateral movements is one of them. And the more symmetrical it is, the less likely I'm thinking we'll have to investigate or go lateral, if you will, because it's less likely that a lateral movement of the spine will be fruitful.